Hello there. What are these swellings on my dog's skin? This is video 3 in this series that discusses lipomas, hematomas, and abscesses on a dog. In this video, I'm going to discuss submandibular and shoulder hematomas. Submandibular hematomas are caused by constant rubbing of the ventral neck against raised food bowls while the dog is eating. What are the clinical signs of submandibular hematomas? You have a very hard swelling with alopecia or loss of hair and sometimes some redness. Swelling may be accompanied by edema. Enlarged submandibular lymph nodes, right? The lymph nodes, submandibular lymph nodes on the right and left sides could be enlarged. Swelling could be presented while already ruptured. Swelling could be presented while already developed into an abscess. So how do you diagnose submandibular edemas, submandibular hematomas? Clinical signs and needle aspiration, you confirm hematoma or a developing abscess. How do you prevent submandibular hematomas? Avoid using raised food bowls where the dog have to strain to access the food. How do you treat submandibular hematomas? Strategy: open and drain the hematoma. Press and retain a drain for 4 days. Administer antibiotic and anti-inflammatory medication. Dispense or prescribe take-home antibiotics and anti-inflammatory medications for 7 days. Place a collar or Elizabethan collar or cone around the head if it is necessary. Let's now look at shoulder hematomas. Shoulder hematomas are triggered by sharp objects that injure subcutaneous capillaries while the dog is rolling on his or her back. What are the clinical signs of shoulder hematomas? The only sign for shoulder hematomas is the swelling itself. How do you diagnose shoulder hematomas? Aspiration of clear blood from the swelling will confirm the presence of a hematoma. How do you prevent hematomas, shoulder hematomas? There is no known preventative nature for shoulder hematomas, unless you can discourage your dog from rolling on his or her back, if that is possible. And how do you treat shoulder hematomas? Strategy: similar to submandibular hematomas. However, shoulder hematomas respond extremely well to just needle aspiration of the blood and then administering a steroid injection to reduce the swelling more, and then some prednisone for 1 week, and then hot fomentation or hot, as some people call hot compress on the hematoma capsule. And that's the end of the video. If this video was helpful, subscribe, share it, comment, or ask a question below. Thank you for watching, and see you in the next video.